Culture of patient safety in the operating room. A brief insight into the importance of providing effective care. Presented by Cindy Ann Bautista. Patient safety can be defined as quite literally the prevention of harm of our patients. Emphasis must be placed on limiting medical errors and prevention of sentinel events. Learning from our mistakes and improvement of our skills through education. We must also have a team-like atmosphere where everyone can work together for the common goal. And lastly, implementation of standardized processes by administration that all can follow for the betterment of the patient. This fishbone diagram shows us how common mistakes such as ineffective communication, poor teammanship, and lack of utilizing resources can be the root cause of how sentinel events can occur. The core basis of being able to provide patient safety is through communication. It is vital to be able to rely on the exact and precise information during the surgical checklist to ensure no medical errors occur during surgery. Utilizing tools such as the language line can help build a trusting relationship with the patient and reduce anxiety, especially when the patient is unable to communicate effectively with the staff. Are nurses feeling secure enough to self-report, or is there a culture of shame and blame when mistakes occur? This can be detrimental when staff are afraid, as it increases the possibility of harm to the patient occurring. Not only is the patient a victim, but the healthcare worker is also made to feel as a victim. Here is an example of the surgical checklist. As we can see, patient safety begins prior to the patient entering the room and ends after surgery is completed just prior to the patient leaving the room. On-the-job training is key to improving the skill level of each healthcare staff member, which then in turn makes them more capable in preventing harm to their patients. This can be achieved through continued education, thereby learning new evidence practices to employ, learning from each other's mistakes, and lastly, administration providing weekly and/or monthly training exercises to refresh skills in surgical procedures and instruments not seen on a daily basis. The Plan, Do, Study, Act model is a viable framework of choice to apply in the operating room in terms of implementing improvements. It utilizes an initial team, which includes the surgeon, anesthesia, a circulating nurse, and a scrub technician to perform standardized processes and analyze the success after each surgical procedure. Careful observations during testing are essential to later determine whether the test ran as planned and did the change lead to an improvement. For effective testing of these changes, testing must begin as quickly as possible and must be used as a learning tool where failures in testing is seen as a tool in understanding how to become successful in the future. In conclusion, safety we provide to our patients fosters a trusting environment which lets patients and their families know they can receive the best care always. It is of vital consequence that we as healthcare workers and as an organization on a whole promote strategies and initiatives that emphasize that providing patient care is an ever vigilant task, and we must have an attitude of always encouraging high quality care as the cornerstone of patient safety. Thank you for watching, and I hope you enjoyed the presentation.